and I think Mr. Arun Panda also mentioned that how to use our resources to the best advantage, because we have common medical issues and also need to do research in some of these common diseases. So the areas of opportunity are telemedicine. Now, because the communication has developed and the technology is developed, so you can have interactive video and so we are, in fact, in our task forces, a lot of the times we are doing video conferencing because it's much easier to come and spend an hour or two on both sides and talk about the common issues. And I think health management systems is something that India is developed very well, especially the IT side, and these are very important. Exchange programs, I think, are more required, and in future we could also look at the joint ventures. So the way forward for us is to set up a task force with the key stakeholders, because what we found out was that when people get together who are in that business, they know exactly what needs to be done. And but along with that, and then this task force should actually give recommendations to both the governments. And what is important here is that to involve the concerned ministries, because unless there is a champion in the ministry, it doesn't move forward. And in our case, we have a champion from the Ministry of Commerce on both sides. And I think that's the way to move forward. And there are 3 other agreements that need to be now put into practice. And one, as mentioned, was the Mutual Recognition Agreement. And this was, I think, signed about 5 years ago, but it needs to move forward. The second was the Customs Agreement. And the third important one is the dispute resolution. So these are 3 agreements. And I think just to end, India's medical tourism actually starts when you cross the border, because when you do that, you get polio drops to do that. Thank you very much.
Thank you, Yaur Ali Saab. So that brings us to the conclusion of the inaugural session that I'm sure you will agree has been wonderful and put the platform in place for the intense and in-depth discussion that will follow. The trade, you will agree, trade in health or trade in general is a non-zero-sum game, and especially between India and Pakistan, it can have substantial spillover benefits going from economics to other areas. So I hope that in the discussion that follows, we're able to identify, as Mr. Panda has already said, specific recommendations that we can take forward jointly between ICRIER and SDPI. Would you please join me in thanking all the panelists, and especially Dr. Panda for sparing his time and giving the kind of inaugural address, and also the panelists, Dr. Rao, Syed Yaur Ali Sahab, Nisha Taneja, and Shahryar Khan Sahab for speaking at the inaugural session. Thank you all very much. And I will beg your indulgence that we will have questions and answers, and we'll have floor interaction following the tea break in the technical sessions. So may I request all of you to join us for a tea, but before you break for tea, we will have a photograph. We need to stand up.